So category 2 is the minor injury. And this is a very common occurrence in my office. Someone will have done something. It might be moving furniture, they twisted their knee in a weird way, or they were playing a sport and they felt something kind of tweak, but they were able to finish playing, or they were exercising in the gym and afterwards they just felt something was a little bit off. There may or may not be swelling, there may or may not be bruising, but the symptoms are usually fairly tolerable and you can kind of manage it with anti-inflammatories and ice and maybe a brace and maybe some activity modifications. If you can function on a day-to-day basis, if you can sleep and you can do your job and you can do all the things that you need to do on a normal day, then you can put up with this sort of thing for quite a while. Now, there are some simple steps that you can take that may help reduce the pain and allow the area to heal. Two problems that I see frequently in my office are that people start to do the right thing, but they don't do it for long enough. So whether that's taking medicine or avoiding an activity or whatever they choose to do, they'll do it for a couple of days and then they'll try to go back to their normal routine. Well, if you've got an injury, a couple of days is not long enough to let it fully recover. And so if you return to activities too soon, you may just re-aggravate the problem. And so then you're never giving your body time to heal and time to get over this injury. So sometimes you're doing what you should, you just aren't doing it long enough. The second problem that I see that's also quite common is that people will try to do something initially, and then when that doesn't work, they don't know what else to do. And so they just kind of sit on it. And sometimes that means rest. So if they like to walk for exercise, but their knee hurts, they just stop walking. And that means they can walk day to day and do their things, but they're not walking for exercise. That's okay as a strategy, but the problem is it's a very passive approach. You're just hoping that this problem gets better, and you don't know how long it's going to take. So you might wait a week or 2 or 3 and then try to resume walking. And so you don't really have any way of assessing your recovery before you just try to test it. And that isn't always the best way to approach a problem like this. So what I would recommend is trying to establish what specific movements or what specific activities are aggravating your knee. And that can vary, again, depending on what you do for a living, what kind of exercise you like to do, and what you've actually done to injure your knee. But several of the things that I see frequently that cause people trouble are rising from a chair or going up and down stairs. So essentially that is putting weight on your knee while it's in a bent position. That position and that movement puts a different kind of stress on the knee than, say, walking on flat ground. So that's one category. Second one would be being in one position for a prolonged amount of time. So it may be riding in the car for several hours if you've got a long commute in the morning on your way to work, or if you work in a job that requires you to be in your car frequently throughout the day. Sitting in one position for a long time, for several hours, and then having to get up and move, sometimes that's what's really causing the pain. Or if you sit at your office chair for several hours and then you get up to leave for the day, or you get up to go to lunch, that initial putting weight on it, that's when you feel the pain. That's noteworthy, because if you can identify that, then you can structure your day to try to reduce or minimize that. Sometimes it's sitting with your knee all the way out straight. So laying flat in bed requires you to put your knee straight, and that may be what's uncomfortable. So by paying attention to what is causing the pain or aggravating the pain throughout the day, that can help you figure out how to manage it better, so that you don't have to just shut down and not do anything. You can continue to do those things that don't aggravate it, but you can avoid or reduce those things that do aggravate it. The other thing that helps a lot with this is regular use of an anti-inflammatory medication. Now, everyone can't take anti-inflammatories. Some people are very sensitive to them. Sometimes you're taking other medications that you need to be cautious about using anti-inflammatories. And sometimes other health problems can limit your use of anti-inflammatories, or at least how safe they are. So I've included another video with this that goes over that in a little bit more detail so that it might answer some common questions or concerns that you might have about using anti-inflammatories. But if you don't have any of those medical concerns, and if you don't have a sensitivity to using those medications, then what I recommend routinely for my patients whenever I see them and they've got a kind of a minor situation, but a nagging problem, is to take something anti-inflammatory, and it doesn't matter if it's Advil or Aleve or whichever one works best for you, but take it every day for 2 solid weeks, for 14 days. Don't wait until it hurts. Just take it on a regular schedule. And maintaining that in your system sometimes is much more effective than just taking it sporadically whenever things flare up and hurt. So by taking it daily, you reduce the overall inflammation, and it just kind of helps you get ahead of the curve. The other thing I recommend highly is using ice. Whenever you get home from the gym or whenever you get home from work, if your knee's hurting, put some ice on it. Ice has some very amazing pain relieving properties, and it can help reduce swelling, and that can help keep things from getting out of control. So regular use of ice, again, for about 2 weeks. The third thing is modifying your activities. And sometimes this takes a little bit of thinking through to help you figure out which activities you can and cannot do. But some of the things that people do on a regular basis are actually a lot more stressful on the knee than you might expect them to be. If you start with the most cautious or the least stressful activities on the knee, that's going to be anything where you're not putting any weight on your knee. So swimming would be an example of that. If you're doing exercises at home or in the gym, you can do upper body exercises. You can probably do a lot of core exercises, and those shouldn't really put any real stress on your knee. But you may not be able to do a lot of the lower body exercises or running or jumping or things like that. But so let's start with the basic stuff. Swimming. That's a very low intensity exercise when it comes to your knee. Now, I wouldn't put fins on because the fins increase the resistance in the water, which makes it harder. It's a better workout, but that does increase the stress on your knee. So no fins if you're swimming. The next step up from swimming, when we get out of the water and now we're dealing with gravity, is anything that has a seat. When you sit on an exercise machine that has a seat, your upper body weight is on the seat, and so there's not as much pressure on your knees. So that's going to be something like a recumbent bike or an upright exercise bike. It could be something like a rowing machine. Those things that have a seat, you're taking a lot of the stress off of your knee. Now, sometimes you'll even have to modify that a little bit, because if it hurts to bend your knee really far, then riding a bike sometimes is difficult. You have to make that turn, and sometimes that requires your knee to bend a lot. So if that's the case, you may need to raise the seat on the bike so that it's not so hard to make that turn. That way you don't have to bend your knee as far, and you may be able to tolerate that exercise better. Also need to turn down the resistance. So if it's got one of those manual dials, turn it down. If you're doing one of those computerized things where it's got, a course mapped out, do ones that are relatively flat. You don't want a bunch of hills. The incline increases the resistance. That makes you pedal harder, and that can increase the strain on your knee. If you're doing something like a spin class, then don't do the part where you're standing up. You want to use the seat to take some of the stress off, so do everything when you're sitting down. If the class stands up, just stay on your seat and just do what you need to. But a bike is a good intermediate exercise, a little more stressful on the knee than swimming, but not as stressful as the things where you are putting weight on your knee without a seat. So then the next step up from the bike or the seated exercises is going to be things where you are upright, but your foot is always touching the surface. So that's going to be like an elliptical or an arc trainer, a Nordic track, or even one of those Stairmaster machines where the little pad moves with your feet. When you take a step and you pick your foot up and you put it down over and over again, that impact jars your knee, and that can aggravate it. So if you can avoid that impact, then you'll tolerate the activity better. Well, with an elliptical, there's no impact. You're standing, so there's some weight on your knee. There's no seat, so it's your full body weight, but you're still avoiding that impact. So you may be able to tolerate an elliptical much better than you can, say, walking on the treadmill, even if you're going at the same pace, because you've avoided that impact on the elliptical. So then the next step beyond the low impact exercises are going to be the more medium to high impact exercises. That would be things like walking on a treadmill, running on a treadmill, jumping. All of those are much more demanding on your knee. And so those need to be the last types of exercises that you return to. The harder part in trying to return to activities, especially like sports and exercise, is that all of those things that we just discussed are in a very controlled environment. All of the exercise machines really only allow you to move in certain ways. When you get into a sports arena, so whether it's golf or tennis or soccer, there's a lot of complex movement in those sports. There's a lot of pivoting, there's a lot of lateral movement, and there's a lot of shifting your weight. So those are hard, and you may not be able to do those until you know you can handle all of the other limited exercises like the treadmill or the elliptical. So it would be better to start with those than to try to get into these complex movements out in space. So you may have to tell your tennis club, you may have to tell your soccer team that you got to take a break for a little while and let things settle down before you get back out there and continue playing. So what's a reasonable time frame to let something like that rehab? How long should you put up with it before you throw in the towel? Well, again, that's going to vary depending on your tolerance for pain, what you have to do on a day-to-day basis as far as work, and how aggressive you want to be with treating it. I don't think it's unreasonable to give it a month, maybe even 6 weeks. But if you've not noticed any significant improvement in your symptoms after 6 weeks of taking medicine and modifying how you do things, then you're going to have to make a tough decision. And that decision is really going to boil down to, do you want to continue living like this with these limitations and restrictions, or do you want to try to do more to get this better so you can resume doing everything that you were doing before? If your answer is you want to do more, then you need to go get it evaluated. I'm a little bit biased in my answer to this question, so I'll be upfront about that. But the question about who you should go see when you've had a problem for, say, 2 months, it's not going away, you've tried to treat it with some simple things and it's not getting better, you decide you want to go see someone, who do you go see? Well, you have all the same options that we talked about in the previous video. You can go to the ER. That really doesn't seem appropriate in this setting, but you could. You can go to the urgent care clinic. That's what a lot of people do. If they don't have a regular doctor, then the urgent care clinic is very convenient. You don't always need an appointment. They're all over the place, and so you can find one that's convenient to home or work or whatever. You could go to your primary care doctor, or you could go see an orthopedic specialist. My recommendation is that you should probably go see an orthopedic specialist. Not just because I am one, but because I know that there are dozens of possible causes for persistent knee pain. And as a specialist, the orthopedist should know all of those and be better equipped to help you figure out which one of those it is. There are sometimes some subtle things that can help you realize, okay, well, we're not dealing with this problem, we're dealing with this problem. And the urgent care clinic and your primary care doctor are not necessarily trained or experienced with knee problems enough to be able to identify some of those nuances. If you go to the urgent care clinic and they do an x-ray and everything's normal, they're probably going to tell you that it's a sprain and that you need to take some prescription anti-inflammatories for a month and maybe do some physical therapy. And then if it's not better, you need to go see an orthopedist. If you go to your primary care doctor, if you're over the age of, say, 35, there's a good chance that they're going to tell you it's arthritis and they're going to give you a prescription. And that's it. Some primary care doctors are better than others as far as their understanding of orthopedic problems and the knee, but I see patients almost every day in my office that have been to their primary care doctor and they've been told that they have arthritis, they've been given a prescription for arthritis, and that's it. They just chalk it up to, I've got a bad knee, it's just going to be like this forever. And that's not always the case. So if you don't want to just take that as the answer, I would see an orthopedic specialist. I would get someone who knows the knee well to look at it, test some things, and help you figure out what it really is so that you can get the right treatment. So that's just my take on it, but that's what I would recommend in that setting.